Welcome, everyone. My name is Carrie Morey. I'm the Academy Coach at the Academies of Racing Case, and we are here today for a panel discussion on how COVID has impacted local businesses. So we have some guests here today to help with that conversation. If you'd like to introduce yourselves.
I'll start. I'm Ed Kamen. I'm the Workforce Solutions Manager for the Racine County Department of Human Services.
I'm Christine Jacobs. I'm with Children's Wisconsin. I'm a school-based child and family therapist.
Hello, I'm John Procunior. I'm the Vice President for EVirgin. We do internet and voice over IP services, and we're located in Raymond, Wisconsin.
And Ariana, do you want to share who you are?
Hi, I'm Ariana Rabe. I'm a CASE high school student. I'm a junior, and I'm also a CASE ambassador.
All right, thank you. So I'm going to let Ariana take it away with our first question.
All right, so our first question is, how has COVID/quarantine impacted how your customers receive your goods or services?
Okay, I went first last time. I guess I'm going first again. So it's drastically changed the way we do things in human services. So considering we're a piece of county government, everything we do is about people. So we don't necessarily produce a good, but we provide services. So, and for example, everything from economic support, which is food stamps, medical assistance, things like that, workforce solutions of what I'm the manager of, meaning we help people find jobs and we work with employers. We have our behavioral health division who provides mental health services and therapy and treatment. And we have our youth and family who investigates child abuse and neglect. And veterans office as well is within human services. So it really has changed how we do things because everything normally has been involved around client contact face to face. So for example, our economic support who does the eligibility has gone to completely everything via the telephone and online. Matter of fact, those staff aren't even in the building. They are all currently teleworking from home, being able to do that. On the other hand, our behavioral services who shut down for a while had to start back up for AODA treatment groups and therapists meeting with their patients because it just sometimes doesn't work as well using the format we're using right now as it does sometimes face to face. So it really has changed everything in the way we deal with it.
Yeah, I'll speak next as far as how my work has been impacted. And Children's Hospital, Children's Wisconsin is a very large healthcare entity. So there's a lot of different operations in the healthcare system. And my role is just one facet. So for most of the questions, I'm going to talk mostly about my role. And Children's does really share a lot of information throughout the system. So there might be times when I have a little more knowledge about the whole system. But for what I do, child and family therapy, like Ed mentioned, it's the same, definitely lots of similarities. We provide services to people, with people, in relation with people. So switching, it was a dramatic switch to do virtually what we were doing face to face, and a little hard to swallow. I'm not going to lie. I was really anxious. It was not a comfort level that I had before. I didn't do any kind of virtual therapy before COVID. So finding out that this is now 100% of what I was going to do. Children's initially shut down all of their healthcare operations except for emergency services, even doctor's appointments. So throughout the healthcare system, when the initial shutdown happened in Wisconsin, all face-to-face contact with patients and clients stopped abruptly. So yeah, I got very quickly, I guess I didn't really get trained on teletherapy. I just jumped in and tried it. So the good news is, even though the format is different, I found out right away that the work I do, the therapy experience that I have translates. I just have to adapt it to not being able to be in the same room with the person. And yet a lot of the work I was doing, I'm still able to do. And it's actually really gratifying to know that the kids and families out there don't have to stop getting mental health treatment and help. We can accommodate that, and I'm still able to do the work I do just virtually.
Similar to Christine, I mean, we had a lot of anxiety over COVID as well. You know, one of the things that EVirgin provides to our customers is residential internet access. So we literally have, you know, a group of people, the customers who are doing e-learning, remote workforce, and automatically need upgrades or need services they didn't have and that kind of thing. And they're purchasing those services from us, but it requires one of our engineers or technicians to actually enter their premise. So we are an essential business, and so it didn't change the fact that that's how we have to operate. We just had to change the way we go about it. So, you know, we tried to really use the CDC guidelines and expound on them and create guidelines not only for our employees, but for our prospects and customers as well. So we would try and prepare our customers to have their homes or their businesses ready for us to show up, you know, stay 6 feet away, allow us access to the rooms that we needed to get into and do our work and that kind of thing. And then, you know, we really supplied our workers with wipes and masks and sanitary equipment. So after every call that they could clean up and, you know, not take contaminants from one location to the next location and that kind of thing. So it really just became us being more and more careful and being aware of our environments. Some of the current customers that we had that required upgrades, we allowed them to come to our office and they would knock on the door and we would give them new equipment or something like that, and they could, you know, manage it themselves. But we didn't allow people into our office. So it really just became us being more cognizant and just being safe in general.
All right, and the second question is, has your business increased, decreased, or stayed about the same since COVID?
And for me, that answer would be yes to all three of them. We've seen shifts in different areas. For in workforce, we've actually had an increase. We have more employers requesting trained employees. We also have a number of people who have been impacted by COVID who no longer have a job, looking for jobs, so matching them up. Now in our youth and family division, who does child protective services, there's actually been a decrease in the amount of phone calls and abuse and neglect. And we relate that to probably virtual school might be one of the pieces, because teachers are one of the primary sources of reporting that. So with that, we've had an increase in need. So that's why we developed our Here to Help hotline. So that's basically a number where people can call of anyone that's been affected by anything, for folks that have somehow fall through the cracks, anything from rental assistance to food to anything else, you name it. So we've kind of had to change what we're doing and how we do it in order to meet folks where we're at.
I think Children's, even though it's a non-for-profit hospital healthcare system, has had a similar experience, being a large entity where different areas have seen decreases and then some areas increases, and some have been able to just operate as usual. For what the work I do, mental health is definitely not an area that's decreased. It has increased. And child and family therapy especially, there's still a very high need for that, and we're seeing it growing. And there's predictions that as we come out of the pandemic, even, there's going to be a greater need for mental health services for children and youth especially. So mental health and our calls and referrals for that have increased. And am not necessarily taking on more work. That doesn't translate to an increase in my workload, because as a therapist, it's a very important duty and obligation to make sure I'm not burning myself out by taking on too much. So even though potentially I could take on more and more clients and provide more services directly, it would not be helpful to me or my employer to have me burn out, to have to leave the profession or the job. So there's an increase in mental health, and I am doing my part, staying busy as usual.
I think we've got similarities across the board. You know, on the residential side of our business, right off the bat, there was a huge spike. People needed more bandwidth. They needed internet access. They were forced into using their home internet in a much different fashion that they were used to prior to COVID. On the business side, it kind of just stalled out, right? Because businesses weren't having people show up at their office and that kind of thing. So, you know, business just kind of went by the wayside for a while. And it then forced us to be creative. We work with the county, and we've established locations around the county where people could go and access free internet, because we saw how vital internet became for people to do e-learning, telemedicine, you know, remote workforce, that kind of stuff. So it forced us to not only grow in certain fashions of our business, shrink or stay the same in others, and then adopt new business practices as a third thing. And what's really interesting about it now is kind of the residential portion of our business has kind of flatlined and plateaued off. Everybody's made the changes that they've needed to make. And the business side is picking up, but the business side is picking up not necessarily on the internet portion of it. The business side is picking up on the voice over IP services, because they've come to realize now that with a pandemic, they need to be able to be fleet on their feet and change. And with their old dated phone systems, it just is what it is. And now leveraging some of the features and functionality with voice over IP, it has, you know, follow me, find me, so they can incorporate their cell phone into their work environment. They could take those phones home or anywhere else and plug them into an internet connection. They'll register and it'll act like they're in the office. So there's a lot of things with the voice side of the house that are changing for the businesses. So if something were to happen in the future, they wouldn't have to do anything drastic. They could just enact whatever their disaster recovery program is or their business continuity plan is, and it would be ready to go on day one.
All right. Did your business have a mandatory or optional work from home order? If so, how many employees stayed at home and how long did it last?
Well, we started originally with a mandatory work from home order, except for essential employees. And for example, here over at Taylor, the fourth floor of this building is the juvenile detention center, which prior to this job, I was the superintendent of that for almost 5 years. All of those folks had to come to work. But pretty much everything else for about the first 3-4 weeks of COVID was just essential employees. We had someone in the building in case someone were to come up needing face-to-face services. Then probably about 2 months down the line, we went on a 25% rotation. So since then, we've had 25% of our staff in the building, all the same staff at the same time, with the idea being if something did spread at work, it would only affect that group. And we're just waiting now. And what we'll probably do as if we get to a point where we're winding down in a pandemic, we'll come back at 50% staffing, 75% staffing, and then full staffing. And then after that, we will sit down and rethink exactly, do we need to continue to do business the same way with what we've learned from the telework and people working from other places rather than being here.
Yeah, with the work I do, the healthcare system closed all of their clinics and except for emergency services. So the majority of Children's Wisconsin employees worked from home. And I am a school-based therapist. So with the shutdown in schools, that was my office. And so I began working from home. about 3 months, maybe about June, when I think that's when the stay-at-home order lifted. We've been in this so long, it's hard to like track. We need a timeline of where we've been and how far we've come. But other therapists were the work from home order ended for them because therapists, we have private offices. That's how we see our clients' confidentiality. So my colleagues who work not in a school setting, but in a therapy clinic, were able to work safely because they can stay in their office with the door closed, and those policies and procedures in place would allow them to see a select number of face-to-face clients. We still didn't want to encourage, then or now, it's maintained that it's a case-by-case basis. There might be times that we need to see kids and families in person to best meet their needs. And yet we want to keep employees safe and clients and families safe, so it's selective. And now my work, because I've started working with clients virtually, I'm able to see them all over the state. So now even if I'm able to be back in the school building, my clients aren't going to come see me in person because they're far away. So that's helpful that it's increased access. Like I one therapist can see lots of different kids and families throughout the state. And I think like other agencies and entities, Children's is evaluating what comes next. Like, what will we do now that we know we can do a lot of our work virtually? So we'll see.
Yeah, right away, we had people working remotely for our organization, but again, because it's an essential business, we had the need for technicians and engineers to show up just to get their equipment at both our facilities. We have one in Illinois, one in Wisconsin. We have large warehouses attached to it with all the equipment and all the equipment needed to make the internet work and the phones work and that kind of thing. And so the outside field technicians needed access to those facilities to get the supplies they needed to turn customers up and to service our customers. So we just tried to stagger when those people were going to be in the office, but the rest of the workforce pretty much worked from home. As things evolved, we allowed people back into the office kind of on an individual case basis and what they were comfortable with doing. We haven't required anybody to come back into the office. We do have masks and things like that available. I'm in the office right now, and while I'm sitting at my cube, I don't wear a mask. But if I were to get up and get a coffee or a drink of water or go to the bathroom or get something off the printer or something like that, we do mask up, and we have stations throughout the office that have cleaning supplies and hand sanitizer and that kind of thing. I don't know if we ever really kind of get back to full staff and everybody back in the office kind of situations. One of the things that this has forced us to do is, prior to COVID, we didn't allow our staff to take their work trucks home with them and that kind of thing. With COVID, we allowed them to do that, figuring that if they loaded up their vans and their trucks with the equipment that they needed, there'd be less time that they could be back in the office and less chance for them to spread COVID. So still to this day, we are allowing those people to take the trucks home and that kind of thing. So, we see people very limited in the office today, but hopefully one day we get back to normal and we can have the socialization that comes with people back in the office.
Has the amount of supplies required in your office building changed, like paper towels, ink, paper, etc.? Has there been a change in the amount of material you supply your employees to complete the jobs?
So supplies, a lot of things changed for us. So because we are a public entity and a unit of government, and we still are seeing people on a case-by-case basis, we had to go through the entire 2244, roughly 70,000 square foot of our first 3 floors and take a look at where we have people and put plexiglass up. So, to create that barrier. Also, as far as social distancing, we planned for the staff that are here to make sure that we can abide by those social distancing guidelines. We even did things like touchless paper towel and hand soap. We installed all of those in all of our bathrooms so people didn't have to touch. Our housekeeping crew, when they came in, are having to sanitize touch points all the time. We had to purchase sprayers for spraying periodically, all of those types of stuff. So yes, as far as work from home, about the only thing that we did, and John had talked about earlier, that were soft phones. So people could have a phone. We did some cell phones, but a lot of the soft phones, so they could use that voice over IP technology to be able to plug back in, and it's pure seamless. So when they called their work number, it rang where the staff were at. As well as, of course, PPE for a lot of our folks. So child welfare, behavioral health, all of the people, when they're going out, they still now go out and do child abuse investigations. Our veteran services officers, big demand on them. So they've been out in the community quite a bit. So it's changed supply-wise, everything we've done. Having said that, we go through less paper towels, less of that, just because we don't have as many people in the building.
I won't speak a lot to this question because I can only imagine the changes that Children's has in their accounting and budgeting. I don't know the details. That is a whole other department's job to manage that. And Ed, you just highlighted how many different facets there are to think about. Things that you add, but then some things are reduced. And really smart people have worked hard to figure that out in Children's for sure.
Yeah, I would say similar to Ed, right? Like I look at Ed and I can see over his shoulder, he's got a thing of hand sanitizer. I have my jar of hand sanitizer. It's all over the place. And we weren't in a position where we needed to have piles of that kind of thing or stockpile paper towels or even toilet paper or anything like that, because mass hysteria was going on, but we just weren't in the office. So, we didn't need it proper to the office. So we did try and get, hand sanitizer and face masks and all the essential things. And we were able to kind of cobble that together, given the resources we had available to us. So that element, I think, is across the board the same with everybody. Where we were maybe a little bit different is a lot of the equipment that we get is made overseas. So getting routers, getting antennas, getting all the technology that we need shipped here in a timely fashion delayed things by weeks and months and that kind of stuff. Even to this day, it's still hard to get some of the stuff from some of the countries. Italy was somewhere that we get a lot of things from, and that was very hard to get some technology from, because as equipment was getting shipped from overseas to the United States government would then quarantine that equipment and make sure that it was safe to be delivered to the next phase and that kind of thing. And then the demand was so high. So these companies that were making that technology weren't ready for everybody to say millions of routers needed to be made instantly or millions of backhaul technology radios or whatever it was. It wasn't ready. We're on a Zoom call right now. I have two kids. When they started doing Zoom, with so many people jumping on, the entire platform shut down. These big carriers that provide all that kind of stuff weren't even ready for a pandemic of this scope. So it just really forced us to kind of do things on a slow roll or in a delayed fashion for the technology and development and delivery of solutions.
All right. Are there any new practices or routines that your company has implemented due to COVID/quarantine? Are there any you plan on continuing in the future when COVID and quarantine are gone?
I don't know if they're new, but I think especially managers and supervisors, look at it differently. It's always historically been, if you don't feel well, don't go to work. But I would say managers and supervisors kind of frowned on that. If someone were to call in and said, I have the sniffles or I can't come in today. And I would say with this, we have learned that if you have any type of symptoms, stay home. And with the ability to do things a lot more virtually now, if you can do it from the office. I mean, again, I don't know if they're new. They've just really made us rethink a lot of those paradigms that we've always had in the past, and now looking that, yeah, it really does make good sense. And not only does it make sense, I'm going to do that. I'm not going to necessarily look down at someone because they said they have symptoms and they don't want to come into work. You never should have, but I think the reality is that's just been, especially with people like me that are at the end of the baby boomer generation, that there was just this idea that no matter what, you come to work.
I appreciate that as a mental health practitioner, hearing that managers are supporting employee well-being, self-care, those kind of things. And yeah, maybe this pandemic did open people's eyes to being kind and compassionate and taking care of oneself and taking care of each other. So that's a good point to highlight. And I guess for children's, the big question is going to be, will people want to continue seeing their doctors or their therapists virtually? This opens up a lot of accessibility, and we'll have to wait and see if there's a desire for this, to figure out, yeah, maybe we're all going to attend more appointments instead of having to drive in the car to go places and take time off, especially to see specialists that may not be nearby. The medical field and mental health field, it's got a lot of potential in it. So I think just telehealth is a really interesting change.
I guess the advantage of being the last person on the panel is I get to say that I agree with everybody. You know, all those things are very true, and Ed and Christine said it fine. What I would add to it is, you know, I think that a lot of employers, us included, were, I wouldn't say nervous, but had trepidation around remote workforce. We didn't know if people were going to respond. We didn't know if they were going to be productive. We didn't know if that was going to work out, right? Like, are we going to get the same kind of things from those people when we don't have the ability to see them, touch them, smell them? They're right next to us. And I think that not just in my industry, but across many, many industries, we've proved that that's something that can happen. We can still be efficient and effective and do our jobs even though we're not in the office. So, you know, not only all the other things that were said, but now we've proven that we can do it from a remote environment, and we don't need to be sitting on top of each other, and we can be respectful of people's space and what they're going to do and what they bring to the table.
All right, we're going to wrap it up there just to respect your time. But we do greatly appreciate you all being here and sharing. It was very insightful just to hear how the different industries were all impacted by COVID. And I want to thank Ariana for being here as well, taking some time to help facilitate this conversation. And that's about it. But thank you very much.